Hello. My name is Emma and this is Catherine, and together we're going to share with you our experience in changing the process of chronic disease management at Kardinia Health. First I'll just start off telling you a little bit about Kardinia Health. It was one of the first GP super clinics opened in August 2010, and it is the most financially stable super clinic and is also the benchmark in Australia. Its purpose is to provide the community with accessible multidisciplinary healthcare and to help train the next generation of the health workforce. And whilst the Kardinia Health building was funded by the federal government under the GP Super Clinics program, it is a not-for-profit practice and it puts any money made back into improving and expanding services. And Catherine will give us an example of how we've done this in chronic disease management. It is governed by the Kardinia Health Board of Management with representation from the Barwon Medicare Local, Deakin Medical School and Barwon Health, and includes representatives from a broad skill base in the community. The clinic is also a high quality training practice for doctors, along with students of medicine, nursing and other allied health professions. And that's just a bit of a mix of the allied health workers that we have, and an awesome team of 6 nurses working alongside the GPs. Now, I was employed by Kardinia Health in March 2012 to work as a chronic disease nurse, and I don't know about you, I'm not wrapped in my title, so if anyone's got better ones for me, feel free to let me know. My previous experience had been 11 years as an emergency nurse, working as a clinical nurse specialist and an ANUM for 8 of those years, so I was used to significant responsibility and working as a team. And whilst the concept of chronic disease management really excited me, I was a little less excited when I started, and I soon became miserable in my new role. I felt like a bit of a handmaid and used to reduce the GP's workload rather than part of the team process in chronic disease management. And I felt like all those years of study and experience counted for little. I was greatly unsatisfied and disappointed in my career change. So there's me, very sad. The process we were using at the time was a little bit messy. We use best practice. Is everyone familiar with best practice? Yeah. And so we had templates on that for our chronic disease. However, we made the switch in the January before I started to CDMNet. Well, some of us had the nurses, if the nurses did the plan, did it under using CDMNet, but many of the doctors would just do their own plans as the patients came in and would still use the old system, and it was a bit of a mess and difficult to work out who was eligible for what and when. Is everyone familiar with CDMNet? No, okay. I'm going to read literally off this, the CDMNet website as to what it is. It's an online web-based service that makes it easier for practices to take a systemic approach to managing their entire chronic disease population. And unlike other software systems that focus only on one part of the process, such as care plan templates, CDMNet supports the entire process of care from end to end, and it helps the GPs, nurses and care team to achieve all the things I've got up on the slide there. All right. So we were using this program, but the GPs weren't really happy. They were more familiar and comfortable with best practice, and I don't know about you, but GPs don't like change much where I work. And they felt like the best practice templates were more personalised than CDMNet, and they were frustrated that they actually had to pay to use this program that they didn't really feel was necessary. So they were using this older system. And that's our poor test patient who's got every disease under the sun. All right, so there's our sad GPs. Our nurses would have been a lot less sad had our GPs looked like that. Our patients were also unhappy, often complaining about the time it took for us to do the care plans. So they would spend 45 minutes with the nurses, and then we'd put them in the waiting room, and then they'd spend half an hour with the GP. So minimum time they'd spend with us was an hour 15 plus waiting time. And we would ask the same repetitive questions every time they came in that weren't personalised at all. They'd often say, you know, do I have to answer those questions again? And for many of them, it was a once-a-year obligation to access the team care arrangements. And for me, I didn't feel like we were managing chronic disease at all. It was just ticking the boxes to get those team care arrangements, and that was part of my frustration. So things reached a crisis point, and the General Manager called a meeting inviting all the staff and board to discuss the issue. And despite the doctor's reservations, the General Manager and the board were very keen for us to continue using CDMNet to meet our clinic requirements and values. So part of the super clinic's objectives is to use effective and efficient technology, and going back to the best practice templates they didn't feel would really fit with the up and coming e-health system and things like that. One of the board members explained that they had had a similar issue at their practice until the nurses had taken it over. So he invited me down to review their process and see what we could do to make CDMNet work for us. I went and observed the clinic in practice, and they shared everything with us, including copies of their letters that they send out to patients and all their handouts, and showed me all the programs that they were using. And it was a real turning point for me and the practice, because it really sparked my enthusiasm to make the changes that we have since implemented. I did consult with another practice over the phone, and again they shared all their processes with us, which was really helpful. I gathered all this information and created this table to present, comparing our practice to the two other practices, and I discussed it with Catherine obviously first. The main difference I noted out of what made chronic disease management successful or not was whether the nurses ran it or not. So we decided we could do that, and we did. We presented it to our General Manager, Clinical Director and Practice Manager, and discussed the findings and proposed a new approach. And these are just some of the differences. We did discover that we were unique at our practice compared to the two that I compared us to. We were doing multiple chronic conditions, any chronic condition, we're not selective. And the main one was that we had over 1,000 patients on care plans already, whereas the other two practices had between 200 and 300. So a big difference, and really hard to, as I mentioned before, it was really messy, so it was hard to get it tidy when we've got that kind of numbers we're working with. So we worked out a system that worked for us. And that's just a slide of the different, some of the different things that we will do care plans for. And as you can see, musculoskeletal is quite a big one. I would have thought diabetes would be much bigger. It feels like we do heaps of those, but as you can see, we do quite a lot. And that is only the, the ones that you can think of. There's lots of other, categories that come into it, MS or, anything we'll do. All right, so what we came up with was a 45-minute consult with the nurse. So that was the same. However, the GP would pop in during that consult at a time that fits. We try and do it sort of towards the end when we've completed all the work and got a bit of a summary for them. And there's a list of all the things that we'll do. And of note on that, for me, it's about helping the patient identify and set goals, and then working out which allied health professionals can actually help with achieving that. A lot of them would, prior to this, would be like, I just want to see the physio to get my back, sorted out. And they have diabetes and be like, well, that's not what this program's about. We want you to see the dietitian and the diabetic educator and the, podiatrist, and make it about, improving the actual disease that they're there for. The other thing that was big for us and it really helped with the patient satisfaction was we made folders for our patients with information related to their disease. We started off with the diabetes because they're nice and easy, and it just lets the patient record their results, so whether it's their blood results or their weight or whatever, and monitor it for each visit they come to. And we're finding that as a really good motivational tool for our patients. We've also done lots of information handouts as well. So we commenced this process in October last year, and whilst I won't lie and say it's been flawless, we certainly feel that the system is greatly improved and it continues to improve every week. I'll hand over to Catherine, who will demonstrate why we've come to this conclusion.
Thanks, Emma, and thanks for having us today. Before I continue with this part of the boring part of the presentation, really, which is numbers and figures, I'd really like to congratulate Emma on the amount of work that she has done. Like many of you, I'm sure, and like most nurses, she's a mother of 3 children. She works part-time. She has a, I'm sure, very demanding husband. And she's such a passionate, professional, inspirational leader. It's an absolute pleasure to work with her. My background is also critical care and emergency. I've been at Kardinia since August last year, and I guess I was really employed to pull together a team of nurses who were struggling a little bit, and we're growing every day, which is great. So the boring bits, really. Can you do that? Yeah. Thanks. As Emma's pointed out, the motivation for a move to nurse-led chronic disease management at Kardinia was really dissatisfaction with the process from both the GPs and the nurses. One of the ways that we established the dissatisfaction was through SurveyMonkey, and there were some not very flattering things said about our program. Most of it appeared to be around financial and time constraints that the doctors had. And as I'm sure you'll agree, the only way to change a GP is to talk to them about money. So as Emma's explained, we did those things, and in the last week we've conducted a survey with our doctors, and these are the results. As you can see, they're fairly flattering, even coming around to agreeing that CDMnet was worth the money, which is nice. And I think the time constraints is really what has allowed them to come on board with supporting us. You know, while we're doing a 45-minute appointment, they see 3 other patients. So they see 4 patients in a 45-minute appointment, and most of the work in hours is done for them. It's one of the things that I found really positive. One of the comments from one of our GPs is that they seem to get less visits from their patients who have chronic disease now, which I think is a win, because we must agree that we don't want patients in the clinic as often. They're less sick if they're not coming to the doctor. Emma's already talked about her dissatisfaction with the process, and I agree with her. I felt like I was ticking the boxes, and we're both relatively educated people, and ticking the boxes is not what we were about. So we we have a snapshot here which I think probably shows you how efficient we have been. One of the efficiency areas that we were looking at is our reminder system and how often we were getting patients back into the clinic to review them. As you can see here, if a nurse put the reminder in, 92% of the time there was a reminder. If a GP put the reminder in, 2.7% of the time there was a reminder in there to get that patient back to make sure they were okay. So I guess since the introduction of nurse-led clinics, we're reminding a lot more people that they need to come to the doctor, but they're coming less often. Now the boring bit, the finances. As Emma noted in her introduction, Kardinia Health doesn't receive ongoing funding. We are essentially a standalone private practice, and as we're all aware in the healthcare sector and the wider business community, we really need to be aware of increasing revenue without increasing costs, but still maintaining a really high quality of care and access for our patients. So at our meeting last year, the executive board and management team had set a target of achieving greater than 6% growth in the area of chronic disease management item numbers. And the one we're most proud of is the 80% increase in first quarter compared to last quarter data in the 732, which is the reviews. So we're getting our patients back to see them. We review our diabetic patients 3 monthly, our asthmatic patients 3 monthly, in line with achieving annual cycle of cares. And we discuss on a client basis how often musculoskeletal patients need to come back, chronic pain patients, and various others. We discuss with the patient and the doctor. There's a few more revenue stream slides here, but I think we might skip over them because we haven't got a lot of time and they're a bit boring. The important thing, I think, to all nurses is that our patients are getting better clinical data and clinical outcomes. So before nurse-led CDM at Kardinia Health, you can see that our HbA1cs weren't great. They were okay, but they weren't great. We're in 6 months, we've achieved a 5% increase, and we're hoping that that will continue over the next 12 months. We plan to do reviews 3 monthly of how our data's going, and we're using the PEN audit tool, which I'm sure you're all familiar with, to pull down that data and to compare it to national averages. What we're using is the APCCP, and I think that shows that HbA1c less than or greater than 7, or equal to 7, is hovering around 40%. Ours currently is 51.1%. So we're pretty proud of an 11% above average. And we'll continue to work on that. And I think our patients are pretty happy with that data too. They all like to think that they're getting better. Where do we go from here, Em? Another really easy data measurement that I'm sure that you're all familiar with is waist measurements in patients who have cardiovascular disease risk. Again, they're showing that, you know, we're measuring more people, and maybe our data's a little bit skewed by the fact that we are measuring more people, but they're also improving. We're getting more people into that normal category, and as the girls pointed out earlier, we also work closely with an exercise physiologist and a dietitian on site, and I think that that's helping. We also have a really active physiotherapy team who work with our exercise physiologist, and that's part of our group management of these people. So I guess from there, what does the future hold for chronic disease management at Kardinia Health? Happier patients, happier doctors, happier nurses, and continuing growth across the board. Our projected revenue growth is still 6% for the next 12 months. Which, if any of you are business-minded, that's a pretty big number, which we're really happy about. And the most important thing, I think, is the satisfaction of our nurses and our patients and our doctors, so that we're all working towards the same goals. We aim to do a patient satisfaction survey in August, which we do every year, and I'm sure that our patients will be telling us, and anecdotally they're telling us, that they're much happier coming to see the nurse every 3 months than sitting around in the clinic for hours waiting to be seen. So are there any questions? Yep.
I thought your presentation was excellent. Thank you very much.
Thank you.
Just summarising, I understand you increased revenue, increased productivity and increased patient outcome. So what reward, as you've led this and implemented such a great strategy, what reward did the nurse get besides work satisfaction?
Besides work satisfaction?
For implementing this?
Yeah. I'm the nurse, the lead nurse or the unit manager, for want of a better term. I don't know that we really have a term in general practice yet for what that person is. I have an exceedingly growing education budget for my nursing team, and hopefully that will continue. Emma's here today, sponsored by Kardinia Health because of the work that we've been doing. Ultimately, I would like to see us financially rewarded. That's going to be an ongoing discussion with the board, but we're both pretty strong girls and I think we'll lead it.
So just to finish off, would it maybe, just as a suggestion, be of benefit to use the cost that you put into the CDM net, actually give that to the nurse and change its strategy?
Yeah, it would. Do you want to come and talk to my general manager?
Sure.
Is that it? We done? Thank you.